Hello, dear doctors. Welcome back to GrowMed. So, this is a session in which we are discussing 10 most important topics from each subject, and this is a video of the PSM. So, as we know that PSM is a very vast subject and it almost comprises of 30 marks, which is a huge for the FMG. So you need to put more concentration in this PSM so that you do not miss any important points. So as it comprises the 30 marks, it will not be the 10 important, but it will be like approximately we will be discussing now 15 to 20 important topics which are frequently asked in the exam, and expecting that questions can be asked from these topics in this July session also. So let's start. And before starting this video, I have already posted on the other subject, so the link will be given in the description box, so do watch that videos also. And for the PDF you can join my Telegram channel. So let's start the video. The most important topic is the vaccine and the national immunization schedule. So you can expect a question from this one, and you just need to mug up this whole table. तो ये जो भी table है, these which vaccines are given and at what doses they are given and what year or weeks they are given, all these things, it is a must do topic. So let's look at those things. So at birth, and this one is the recent updated version, because earlier we were following the another schedule, so I'll discuss that also as well. At birth we will be giving 3 vaccines: BCG, OPV and the hepatitis B. So how will we remember it? So at birth starts from the B. So BOH, you can remember that birth equal to BOH. ऐसे करके you can remember it. So which 3 vaccines? BCG, OPV and the hepatitis B. Then moving on, at 6 weeks, which all vaccines we will be giving? Earlier it was the 7 vaccines which we were giving, but now it is changed to the 5 vaccines. And which are the 5 vaccines? OPV. See, OPV we are giving at birth, so just write it here also in 6 weeks. OPV dose 1. Then we will be giving the Penta V1, pentavirus 1, Rota 1, FIPVC and PCV. So how to remember this one? See, MNOPQR ऐसे करके these comes in the alphabet manner. तो O से हमने याद कर लिया था OPV which is coming here, and after that O के बाद it will be coming P, so it will be pentavirus. Q को skip कर देना, then P से again it will be the PCV which will be coming, and fractionated P vaccine. तो P से we will be giving 3 vaccines, and from R we will be giving 1 vaccine. O से 1 vaccine. So like this you can remember it easily. O P Q R S T ऐसे करके the alphabet sequence. Then OPV1, P से 3 vaccines, Penta, P fractionated PV and PCV, and R से Rota. ठीक है. Then 10th week. So 10th week we will be giving the 3 vaccines. So how to remember it? See, यहाँ पर हमने मतलब another thing, अगर 6 weeks में यू आर नॉट एबल टू रिमेंबर कि कितने वैक्सीन हम एग्जैक्टली दे रहे, तो यू कैन जस्ट रिमेंबर लाइक दिस ऑल्सो. 6 - 1 करना है, इट विल बी 5. सो वी आर गिविंग 5 वैक्सीन इन week 6, and we had discussed the 5 vaccines. Now about the 10th week. 10th week में you can remember it. 6 - 3 कर दो, 3 will be remaining. So in the 10th week we will be giving the 3 vaccines. Then put all 3 vaccines. ज़्यादा दिमाग लगाना नहीं है, just it is very simple. The first 3 vaccines which we are giving in the 6th week, just copy paste them. OPV, Penta, Rota. You can just apply OPQR, same here. Q skip कर देना, OPR. Okay, 3 vaccines we are giving in the 10th week. Then moving on to the 14th week. In the 14th week, 5 vaccines we will be given. How can you remember that? 10 - 5 कर दो, it will become 5. तो 10 का हाफ होगा 5, तो 14 वीक में 5 वैक्सीन हम देंगे. 10 का आधा वैक्सीन हम 14 वीक में देंगे, ऐसे करके यू कैन रिमेंबर इट. सो इट विल बी 5. एंड कौन से 5? जस्ट कॉपी पेस्ट द 6. तो 6 वाले पे हम जो वैक्सीन दे रहे, जस्ट कॉपी पेस्ट इट एंड ऐड द डोज 3 3 3, FIPVC 2, PCV 2. Okay, so you need to remember this 1 2 3 also, because these only things will be confusing. तो 6th week में all 1, 7th week में we will be giving the second dose, 14th week में we will be giving the third dose and the second dose of these two vaccines. Then 9th month पे we will be giving measles or MR first dose, then PCV booster dose, Japanese encephalitis, vitamin A and FIPV third dose. Okay, so in the 9th month we will be giving the 4 vaccines, 1 2 3 4 5 sorry 5 vaccines we will be giving in the 9th month. तो इसको ऐसे याद रखने के लिए कुछ निमोनिक है नहीं मेरे पास या फिर कुछ ट्रिक नहीं है, जस्ट आप इसको ऐसे याद रख लेना 9 months we will be giving the 5 vaccines and the name of it. And this one is important, vitamin A is important because we will be starting the dose of the vitamin A in the national immunization schedule every 6 months from 9 month onwards till 5 years. So the first dose will be given at the 9 months and we will continue it till 5 years. And also the questions are asked on the dosage, so it will be the 1 lakh international unit which we will be giving under this schedule every 6 months. Then 16 to 24 months. So what all vaccines are given in this period of time? 4 vaccines we will be giving: the DPT third dose, then OPV booster dose, measles MR2 and the JE2. See, in the 9 month we had done the 1 and this MR1. So just copy paste it, MR2 and the Japanese encephalitis 2 in the 16 to 24 months period. Then at 5 years we will be just giving the DPT booster dose, then 10 year 1, 16 year 2 TD, and in the pregnancy also we will be giving the TD. So this is also important. See, frequently questions are asked on this pregnancy and the TD doses, and there's a proper what can I say, a proper like let me show it to you here, a proper plan kind of a thing. You need to look at the particular factors and then decide which vaccine you will be giving. So if the childbirth is more than 3 years, then you need to give 2 doses. So the childbirth मतलब कि देखो, एक pregnancy में a female will be taking up the TD vaccine. तो next pregnancy में you need to look कि गैप कितना है दो बच्चे के बीच में. If it is more than 3 years, then you will be giving the 2 doses, and if it is less than 3 years, then you will be giving the booster dose only. Okay, तो 2 doses हम कब देंगे? 2 doses given at the time, first one given at the time of the confirmation of the pregnancy, and second dose we will be giving 2 weeks later. Then if the childbirth is less than 3 years, then the TD booster dose at 7 months. So you need to mug up this whole table because it is very very important and repeatedly questions are asked on this. Okay, so this was about the TD vaccine which you must know. Then okay, so this was the whole national immunization schedule which is updated now, and you need to remember this also. And along with this, it's better if you remember the old version also, because we just can't expect what will be happening with us at what moment, and what if the examiner's mind changes and he will ask the old schedule. So we just cannot assume what will be coming in the question. So it is better that you look at the previous also, which was that in the 6th week we used to give the 7 vaccines, and now in the 10th week we used to give 5 vaccines earlier, but now we are giving the 3 vaccines. So the 5 vaccines are the HIB which was included in it, and along with the DPT was also there. So these are, we are not giving them, and instead we will be giving the pentavirus. Then in the 14th week it was 7 vaccines which were given in the 14th week. In the 9th month it was the same, the 4 vaccines which were given in the 9th month, and in the 16 also it was the 4 month, and rest all these things are same. So just have a concentration on the 6, 10 and the 14th week. Then moving on to the types of the vaccines. So these are classified into various types based on their preparation and based on their composition. So live vaccines, so these are the examples of the live vaccines. Almost all the vaccines are the live vaccines. So if you do not remember this statement or these things also, it's okay, you need to just remember the killed vaccine: rabies, IPV and the hepatitis. So these are the killed vaccines. The rest all are the live vaccines: the BCG, OPV, MMR, typhoid, JE, yellow fever, varicella, rota, and the typhus. So all these are the live. You just need to remember 3 exceptions: rabies, IPV, and the hepatitis A, which are the killed. Then moving on to the toxoids. So toxoids, diphtheria and the tetanus, 2 types. Then proteinaceous, pertussis and the anthrax. Then polysaccharide, meningococcal, pneumococcal, and the HIV. The recombinant are the 2 categories, hepatitis B and HPV. So these 2 are the viruses, right? So you can remember that recombinant matlab virus wale vaccines hai, and mixed or combined DPT, MR, MMR, MR and the TD. See, mixed or combinant matlab more than one composition is present in this. So DPT में डिप्थेरिया, pertussis, tetanus and MMR में measles, mumps and rubella, and इसमें भी measles, mumps and measles and rubella, and TD में okay. So these were the mixed. Then moving on to the route. This one is very important because questions are asked on this route of the vaccine. So nasal vaccine, live influenza. This was a PYQ, that live influenza is given via which route. So it is the nasal. Then for the oral इज ईजी टू रिमेंबर. सी ओरल में ओरल पोलियो वायरस आएगा तो वो ओरल देते हम, और रोटा वायरस भी ओरल ही देते हम, बिकॉज रोटा वायरस ऐसे याद रख लो कि इट विल कॉज इंटूसिसेप्शन, राइट. तो इंटूसिसेप्शन साइड इफेक्ट कब कॉज करेगा, अगर ये ओरल ही जाएगा तभी ये इंटूसिसेप्शन कॉज करेगा ना, तो इट विल बी ईजियर टू रिमेंबर लाइक दिस. देन द टाइफॉइड इज ऑल्सो अ GI डिसऑर्डर एंड कोलोरा इज ऑल्सो GI डिसऑर्डर. So in these things we need to give the vaccine orally, so you can remember that typhoid, cholera, rota, OPV, all these are given orally. Okay, then the doses, OPV 2 drops are given and rota 5 drops are given. Then intradermal are the BCG, rabies and the IPV. So BCG was a PYQ. Then subcutaneous MMR, measles, Japanese encephalitis and the yellow fever, and IM, DPT, TT, hepatitis B, IPV, killed influenza and the typhoid. See, live influenza was given orally, but killed is given IM. Most of the vaccines we will be giving by the IM. So don't remember this IM once. Just remember the exceptions like the BCG, then the OPV, rota, ये तो easy है, you will be remembering it. Live influenza याद कर लो, and BCG, rabies, IPV याद कर लो, and rest the measles, Japanese encephalitis and yellow fever, we will be giving it by the subcutaneous route. So see, all these things are very confusing. At once when you read, these things will not be remembered, and as we have very less time also now, so I suggest you, if at all you do not remember these things like by heart, whenever I say live influenza route, तो nasal आपके मुंह में ऐसे आना चाहिए फटफट. And if these are not that perfect to you, then I suggest you that note down all these things in a paper, stick it on your study table, and daily 10 minutes please look at these things, because be very helpful to you. मतलब एक बार में सारी याद होने वाली चीज़ें नहीं है ये, तो you need to remember these things like daily, divide it and daily have a look at it. It will hardly take 10 or 20 minutes, and if you look at it continuously for 20 days from now, 20 days be, if you look at it, then it will make a memory, and these things will be imprinted in your mind and you cannot miss this. तो मतलब वैक्सीन से you can expect 2 to 3 questions, and कभी कभी 4 से 5 questions भी आ सकते हैं, तो this is very important. Then the lyophilized forms, which are the powder form, and the vaccine, how will we dilute them? These are the dilutants used, and for BCG we will be using the normal saline, yellow fever, cold physiological saline, Japanese encephalitis, phosphate buffer solution, HIV, DPT or saline, and for the measles we will be using the distilled water. Okay, so these are the things which you must remember. Then vaccines which are contraindications. So pregnancy is asked multiple times, so you need to remember this one. All live vaccines except yellow fever. Why? Because it is a state of immunocompromised, right? The patient is immunocompromised in case of pregnancy, and if we give the live vaccine, it can cause adverse reaction. Then during lactations, yellow fever is contraindicated, rest all vaccines can be given. In HIV, all live vaccines same, immunocompromised patients we cannot give. Then premature infant, hepatitis B we cannot give. Then epilepsy, in case of epilepsy, pertussis vaccines we cannot give. Then Okay, I have written it 2 times. Then during epidemic or post disaster, all the vaccines are contraindicated except the measles. Okay, the measles, I think it is very fast acting, so we can give measles. Rest all vaccines take time to show its action also, so that's why we will be not giving it in case of post disaster. Then moving on to the adverse effect. So the observation time is 30 minutes. That means after we administer a vaccine, we need to wait for 30 minutes to look for the adverse reactions. Even after 30 minutes, the reactions are not visible. That means the patient is all right and there are no side effects related to the vaccine. Now observation time is 30 minutes. Then OPV causes paralysis. Must know topic. You can remember OPV, P से आएगा, P से paralysis. OPV, P आएगा, P से paralysis. Okay. Then in case of hepatitis B, it will cause hypersensitivity reaction and also it may cause shock. तो H hypersensitivity reaction, hypersensitivity का next word है S, तो S से shock. Then measles will be causing TSS and febrile seizures. Then rotavirus will be causing intussusception, which is a PYQ. Then pertussis persistent crying. Pertussis persistent. See, PER. तो मतलब similar है, इसीलिए pertussis persistent crying. Then killed influenza or swine flu will cause GBS, Guillain-Barré syndrome. This one is also important. Then MMR and hepatitis B will be causing thrombocytopenia. Okay, so these were the adverse reactions, and the ones I have marked in star mark, those are important. So TD vaccine we have discussed. So this session is gonna be a little bit lengthy because we have a lot of important things and high yield topics from the PSM which we must know. Matlab, you just cannot miss this topic. So let's discuss all those things, that in the last minute one video you will be watching and you'll be like satisfied that हाँ चलो मैंने PSM अच्छे से करा हुआ है. Okay. Then storage of vaccines, ice line refrigerator. It is used at the level of the pH. This is the image of this ice line refrigerator. Image based question was asked. Then walk-in refrigerator. It is used at the level of the state. Then the vaccine carrier, this one, and they are used for the transport, and the ice pack for the immunization. During the immunization we will be using this ice pack. So you can see here, यहाँ पर वाटर लेवल, यहाँ तक हमको वाटर की कंटेंट भरनी पड़ेगी. You can see here 2 holes and these holes are for the vial. तो जो वैक्सीन वायल है वो रखने के लिए these holes are there. Then moving on to the vaccine vial monitor. So already I have uploaded a video on this vaccine vial monitor in which I have completely explained all the things in detail. Now we'll be just quickly revising it, what questions are asked. So this is the 1, this is the 2, not used, 3 used, sorry, these are used, 3, 4 not used. Because see here, this square mark and the circle mark, this one is lighter so can be used, darker cannot be used. Okay, then the another important topic is the open vial policy. And what does this mean? The vaccine can be used up to 4 weeks or the 28 days. मतलब कि जैसे हमने वैक्सीन ओपन जो वायल है, if we open that vial and some vaccines we just cannot follow this one, so for that we will be discarding the whole. But for some vaccines we can follow it, and which all? DPT, hepatitis B, TD, PCV, IPV and the OPV. So these vaccines follow this open vial policy. That means we can keep the vaccine vial open for 28 days, and up to 28 days we can use this, not more than 28 days, up to 28 days. So the question was asked that this open vial policy is not followed by which of the following vaccines. So in the option they had given measles and the other options from this one. So measles was the answer. Okay, so you need to just mug up these whole things. Okay, then moving on to the levels of prevention. So 20 minutes passed and now we are just finished about the vaccine. So much to read in the vaccine. Then about the levels of prevention, already I have uploaded a video, a short video in the levels of prevention. So do watch that video also. The link will be given in the description box. Now it is classified into primordial, primary, secondary and tertiary. So primordial prevention before the occurrence of the risk factor. Example, source reduction in the malaria, health, education. So before the occurrence of the risk factor, that means the risk factor is absent, not yet, the risk factor is not yet come into this prevention, and before that only we are taking the prevention. Then what happens in primary is that the risk factor is present but the disease has not yet started. And just remember these things and it will be easier, because in exam they'll be asking a lot of examples, like various examples they'll give, and they will ask that which kind of prevention it is. So if you remember these things, then you can identify, apply your concept, and easily you can identify what the examiner is trying to ask. So in primary, what happens is that risk factor is present but no disease, and again classified into two: health and specific. Health means the prevention will be happening at a mass level including the community. So at a level of the community if it is happening, it is primary. Specific matlab individual will be involved in it. So midday meal control, air pollution, safe water supply, all these are the health prevention. Whereas specific vaccine, OCP, mosquito nets, iron, folic acid tablets in pregnancy, helmet, chemo prophylaxis. Okay, all these occur in the specific. Then secondary mein early diagnosis and treatment. Just one thing you need to remember in the secondary, that all the screening tests what all we will be doing, all these will be coming under the secondary. And in this the risk factor is present, the disease has also started, but our aim is to stop the progress of the disease. Okay, then prevention of the complication of the diseases. Example, various screening tests and annual health checkup. So they will give the examples of the screening tests like pap smear or mammography in case of a breast cancer, like that. Then tertiary, so tertiary management of the complications. So the risk factor is present, disease is progressing, prevention of the disability. One famous example is the spectacles, second is the rehabilitation, whatever we will be doing. So this is the thing which you must remember from the levels of prevention, and expecting a question from this one in the July 8th session. Then moving on to the Suraksha clinic and Anemia Mukt Bharat. So already I have uploaded other videos from the PSM discussing vectors, then the important national health programs, then vectors have discussed, then also images which are important. So I suggest you to watch all those videos, because if you watch all those videos, 50 to 60% of all the high yield topics from the PSM will be covered easily. The Suraksha clinic, sexually transmitted diseases or infections are usually come under this Suraksha clinic, and this is the logo. So image based question was also asked on the logo. Now how will we do the treatment? It is classified into the 7 kits, and the kits are given particular color. The kit 1 is gray color and used for the urethral discharge, anorectal and the cervical discharge. So clinical case, short case kind of questions are asked, that a patient comes with a cervical discharge, which kit you will be using. So they can either give gray kit or kit 1 in the options. You need to choose whichever is there. Then 2 given for the vaginal discharge, PYQ. White for the genital ulcer diseases which are non-herpetic form. Blue, genital ulcer diseases which are non-herpetic form but are penicillin allergy. That patient we will be giving the blue kit. Then red kit given to the genital ulcers herpetic form, yellow for the PID, and black for the inguinal boo-boo. So this is also PYQ, PID wala. Then moving on to the Anemia Mukt Bharat. So this is also must do topic, and in all the papers this question is asked on the Anemia Mukt Bharat. So beneficiaries include 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. And this table you need to mark up this table. This is the logo and this table. So for 6 to 60 months we will be giving 2 tablets in this scheme, 1 iron, 1 folic acid. So these are the mgs, how much dose we will be giving, and this is the frequency when we will be giving. So the iron for 6 to 60 months 20 mg is given, and no folic acid we will be giving bi-weekly. Then 5 to 9 year it is 45 mg, 400 folic acid bi-weekly. 10 to 19 years, so the question will be given like adolescents. So 10 to 19 years they will not give in the question, they'll give adolescent group. In the Anemia Mukt Bharat, the adolescent group is given how much dose of the iron and the folic acid, ऐसे करके दे देंगे just to confuse you. Okay, so adolescent में it will be 45 and 400 same, but we will be giving it weekly. Then 20 to 49 years female, 60 mg and 500 folic acid giving weekly. This one is a PYQ. तो प्रेगनेंसी में 60 500 डेली देंगे. See the difference in normal females who are not pregnant, they will be given weekly, but in case of a pregnant female we need to give it daily. Then lactating also same, daily. Then moving on to the clinical trials. So clinical trials classified into various phases. So the preclinical carried out on the animals, then phase 0 in which we will be doing the phase on the healthy human volunteers, and microdosing is done mainly. Then 10 to 20 people are done. Only on 10 to 20 people this one is carried out. So the numbers here, they are the amount of the people in which the doses or the studies is carried out. Then phase 1 healthy human volunteers. So we will be looking at the safety and toxicity in the phase 1 and also maximum tolerated dose. So in this we will be testing it on 20 to 100 population. Then phase 2 3 and 4. So phase 3 onwards we will be doing the tests on the patient and the patient. Then in phase 2 efficacy is tested mainly in the phase 2, and in the phase 2 maximum drug failures happen and the population is 100 to 300. Phase 3 में comparison with the existing drug and randomized control studies are done. Then the population 300 to 3000. Drug launch in the market occurs only after the phase 3. So this was a PYQ, that when will a new drug be launched in the market. So it was the phase 3. Then phase 4 long-term side effects, post-marketing surveillance, multiple time, then more than 3000 population. So you need to remember this population also, because this is an important topic asked in integration with the pharma also. See how will you remember the people. 10 to 20, 20 से 100, 100 से just go on increasing the numbers, like tens से 100 आ गया, 100 से 1000, 1000 से more population, thousands फिर 1000 से lakhs में जाएगा, तो it will be the phase 4 ऐसे करके. Then the demography. So the demography, it is the study of the population, and we will be looking at the 3 parameters mainly: size, distribution, the size, the distribution and the composition. So this was a PYQ asked recently in the Jan 24, that the components of the demographic process. तो मतलब कि question में these all components were given and they had asked that these components belong to which category, and the answer was demographic processes. So 5 components: fertility, marriage, social mobility, migration and the mortality. Then moving on to the demographic transition model, must know. So in the recent Jan exam only, there were 2 questions asked on this demography. One this one and another on this table or this chart. So whatever you see, this chart, this one you need to mug up these things. So divided into the 5 stages, 1, 2, 3 and 4 and 5. So stage 1 called as the high stationary, early expanding, late expanding, low stationary and the 5th one declining. So what happens in the stage 1 is the birth rate and the death rate both are increased and they will be approximately equal. The both rates will be equal approximately, and in the late expanding the birth rates are very high than the death rates. So there are more birth rates happening than the death rate. Then in case of this late expanding, the birth rate are more than death rate but not that more as compared to the 2. तो 2 से अगर compare करेंगे तो it will be less only. Then India comes in this late expanding phase 3 PYQ. Then in the low stationary, all the 2 things will be decreasing. The birth rate, the death rate, both will be decreasing and approximately they will also be similar. And in the 5, birth rate is less and the death rate will be more. Such kind is seen with the Europe PYQ. Okay, I think you've understood this. So you need to mug up like high stationary, then उसके बाद में क्या होगा, अर्ली एक्सपांडिंग होगा, फिर लेट एक्सपांडिंग होगा, फिर लो स्टेशनरी होगा एंड देन आफ्टर दैट डिक्लाइनिंग. एंड व्हाट हैपेंस इज यू कैन रिमेंबर लाइक हाई स्टेशनरी है ना, तो दोनों बर्थ रेट and the death rate both are high and in this both are low stationary में birth rate and death rate both are low, both are high. Now Declining में death rates more, birth rates less. And in case of early expanding and late expanding, easier to remember, birth rates are more than the death rates, but इसमें थोड़ा सा कम है, इसमें थोड़ा सा ज़्यादा है. And like this you can easily remember this, and if you write and practice just 2-3 times, then you'll not forget it also. Then moving on to another important parameter, that is the demographic gap. So gap between the death rate and the birth rate, this is called as a demographic gap. It is maximum at the phase 2. So phase 2 mein this gap is maximum, and minimum in case of phase 1 and phase 3, and negative in case of phase 5. See, as you can see here, this greeny, this purple wala is for the birth rate, this green wala is for the death rate. So you can see the gap, this one is maximum in case of the phase 2. Then moving on to the population pyramid. So this is the population pyramid, and it is a double histogram. The height of the pyramid says about the life expectancy, because the age, so this one is the age of the newborns, then it will be going up, and this one is the age of number of the old population. Like this, the age, it goes on increasing. Then base indicates the fertility, and symmetry indicates the sex ratio. Okay, so in case of developing countries, the graph is looking like this, the graph will be something like this. But in case of developed countries, the graph will be the spindle shaped, something like this, that the working population will be less, and the old population is high, and the fertility rate is also low in those in the developed countries. So it is the spindle shaped which will be there in the developed countries, the population graph. And this base indicates the fertility, and this size, see, this is the symmetry and indicates the male and the female ratio. Okay, then the family cycle, this is also very important, and these are the phases of this family cycle. So the first phase which happens in the family cycle is the formation, and in this formation the events happening, that it begins from the marriage, and ending of this formation happens when the birth of the first child. ठीक है, तो formation मतलब we can just remember it, या फिर recall कर सकते हैं हम इसको ऐसे कि दो जन मिल जाएंगे तो it will be like a formation. So marriage से start होगा, and जब first child की birth होगी it will end. And extension is birth of the first child, begins at the birth of the first child, and birth of the last child. So how you can remember it, that after formation one step आगे जाया ना, +1, तो it will extend करके, तो you can remember that extension में ये family जा रही है in case of the extension. ठीक है, then in case of complete extension there will be birth of the last child, and the first child will leave the home. तो you can assume that extension हो गया, फिर birth of the last child भी हो गया, and then after that it will be called as a complete extension. मतलब कि एक बच्चा first child will leave the home also, then that will be called as a complete extension. Then in case of contraction, the first, sorry, till the first child leaves the home, it will be the complete extension. मतलब कि इनकी family complete हो गई है अभी, है ना, तो extension हो गया, extension के बाद they have completed the family now. When the first child will go, -1 फिर से हो जाएगा, then it will be contraction. तो subtraction, contraction, ऐसे you can remember it. तो contraction हो गया when the first child will leave the home, till the second child leaves the home, it will be called as the contraction. Then when the second child will also leave the home, last child leave home, and first spouse dies, that period is called as the complete contraction. मतलब -1 हो गया, it will be the complete contraction. And after the death of the first spouse till the death of the survivor, it will be called as the dissolution. मतलब कि जब दोनों ही मर जाएंगे, then it will be called as the dissolution of that family. Okay, so these are the phases of the family which you must remember, and these are also high yield topic asked in the FMGE exam multiple times. So questions are like asked on the sequence of these phases also, that formation will be happening, then extension, complete extension, contraction, complete contraction, and the dissolution. This kind of question has been also asked, and definition has also been asked, that what does the formation phase stands for, and they'll describe the definition of this in the options, and you need to choose that one. Then moving on to the methods of the communication. So this is also a repeat topic, and various methods are there for the communication. So we'll discuss one by one. So the lecture, in this what happens is the one person is addressing to a group, and the group consists mostly of less than 30 degrees. Then focused group discussion asked multiple times. So I feel this is the favorite question of the FMGs, repeated multiple times. And also image based question is asked, that a table will be there and there will be 6 to 7 people sitting around a table and they'll be discussing. तो अगर ऐसा कुछ image आया, then go with the focused group discussion. So it is a group of 6 to 12 people with sit on a round table, and they discuss mainly about the health programs and the health issues. Then interpersonal communication, it is one-to-one communication, and it is the best, and this is used between the doctor and the patient. तो डॉक्टर और पेशेंट की कम्युनिकेशन को हम ये इंटरपर्सनल कम्युनिकेशन बताते हैं. तो जो एग्जाम्पल दे बी गिविंग लाइक कैंसर, तो हाउ विल यू convey the message to the patient, by using which method you will be conveying to the patient the message that he has cancer करके. तो it will be interpersonal communication. Then panel discussion, this one is also the favorite question of the FMG, and 4 to 6 experts discuss in front of an audience. See, 4 to 6 experts will be there, and they'll be discussing in front of a huge number of people, and no specific pattern of speeches is seen in this panel discussion. But whereas in symposium, what happens is that it is also a lecture given by the experts, but there is a specific set of speech which the experts need to follow. This is also expert, but in this there is no specific pattern of speech, and in this there is a specific speech of the specific pattern of speech is there in this symposium. Then workshop, series of more than equal to 4 meeting, and there's a proper plan of action present in this workshop. Demonstration is also a favorite question, so done step by step, and seeing two principles that are followed in this demonstration is seeing is believing and learning by doing. So examples में they will be describing like the ORS preparation, then rabies vaccine, क्या बोलते हैं, cleaning of the rabies, dog bite cleaning of the dog bite, ऐसे करके they will be describing some things in the question if they want to ask it in integration with the clinical case, or if they want to make the question lengthy. So these are the methods of communication which you must remember. And then moving on to the next system, that is the healthcare system. So this is also a very important topic. In this topic you need to remember all the things like levels, किस level पे कौन सा function होता है, which healthcare worker will be working at which level. So this is classified into the primary, secondary and the tertiary level. In the primary, the community health workers, sub centers and the primary health cares will be coming under this primary level. Then in the secondary level, the community health centers, CHCs and the sub-district hospital will be coming under the secondary level, and the tertiary level, medical colleges and the district hospital coming under the tertiary level. So this one is the secondary level or the CHC. They will be giving the CHC or the secondary level. This is the first referral unit, and the tertiary level is the second referral unit. Whenever we will refer the patient to the medical college or the district hospital, it will be the secondary referral unit. Then questions are asked that number of beds, number of staff and also the number of population that are treated in the particular center. So in case of the primary level at the sub-center, so these are the values for the sub-center. In the sub-center, in the plains, one sub-center should be there for each 5,000 population, and in the hilly areas 1 per 3,000 population, and likewise this one, the PHC. So this is the values for the PHC. In the plains 1 per 30,000 and 1 per 20,000. This was a PYQ. So you need to just mug up this whole table. याद करो इसको, रट्टा मारो. Then asked on the delivery, questions are asked on the delivery. So delivery, who can conduct the delivery and how many deliveries can be conducted. So at sub-center again divided into type A and type B. Type A cannot do the deliveries, whereas type B can do the delivery. Whereas in PHC, type A and type B. So emergency मतलब कि if there is emergency that a female now she should be delivered, and low risk cases, mainly low risk cases can be delivered here in the sub-center. And in case of the PHC type A and B, less than 20 per minute in case per month in case of type A, and more than equal to 20 in case of type B. Then the services provided by the CHC, first referral unit, as we had discussed, blood storage facilities, specialist doctors, then all the specialist doctor like the surgeon, then the ophthalmologist, orthopedic, all. Then rehabilitation units are present and the geriatric clinic is there. Then for the PHC, this one is a repeat topic, PYQ. Questions are asked on the elements and the principles. So what will comes under the elements? We can remember it by mnemonic elements itself. E से education health, health education, मतलब to make it easy I have written it education health. तो है तो असल में health education मतलब कि educating the people about the health. Then L से it will be the local endemic disease. E से essential drugs, M से MCH care. Then E and I थोड़ा सिमिलर है ना, तो you can remember that I से immunization, N से nutrition, T से treatment of the common diseases, S safe water supply and sanitation. So these are the things which will be coming under the elements of this PHC, and these are the 4 principles which are there in the PHC: equitable distribution, community participation, intersectoral coordination, and appropriate technology. Okay, so you need to mark up all these things. Then the intensive neonatal unit, this was a PYQ, that it is present in the district hospital. So question was asked that CHC done all the services provided by the CHC except, and in the questions intensive neonatal unit was there. So this is not present at the CHC, this is present at the district hospital, that is a tertiary level. Then moving on to the grassroots level workers. So these are the grassroots level workers: ASHA, multipurpose worker, village health guide, then TBA and the Anganwadi worker. So these are the location where there will be working, like the ASHA will be working at the village, multipurpose sub-center, the rest village and the Anganwadi. So this is the population, for how much population they will be working, that ASHA will be working for 1000, and this was a PYQ. Multipurpose worker 5000, village health guide 1000, then TBA and Anganwadi. Then these are the criteria on which we can choose them as the ASHA or the multipurpose worker. So this is the qualification that is required. So the ASHA should be 10th pass, or we can reduce it to the 8th pass also. Then 23 days training. So this one is the days for which they are trained, and for the ASHA she needs 23 days training. Then 12th for the multipurpose worker, 12th pass. Then VHG 6th. Then for this TBA there's no need of any qualification. Then Anganwadi 10th pass. So this is the training which they'll be undergoing, and this was a PYQ, that multipurpose worker was given by which committee? So Kartar Singh committee, and the which village health guide was given by the Srivastava committee. Then these are the functions of the ASHA workers. So this was a PYQ, that all of the following are the impact indicators except. Then the functions of the ASHA: she is a part of the National Health Mission, and these are the functions. So she is a part of the Janani Sishu Yojana, and she will be promoting the hospital delivery. See, one thing you need to remember, that the ASHA will not be conducting the delivery, she will be taking the patient to the hospital for the delivery. Then home delivery of the contraception, home based newborn care, that means she will be visiting the homes of the newborn, and they are given, like if it is a low risk baby then she should do 5 visits, if it is a high risk baby then you need to give 8 visits, something like that. It is such a huge calculation that is present, but that's no need right now which you to remember. You just need to remember these things. Then child vaccination and IFA tablet delivery. Then impact indicators: decrease in the infant mortality rate, TB, leprosy detection, and child malnutrition rate. Then the other important things to remember from the ASHA, because questions are repeatedly asked on this ASHA, matlab ki you can expect a question in each paper from this ASHA, and either these functions are asked, or ASHA works for how much population that are asked, or they'll give 4 or 5 statements and they'll ask which is true or which is false. So she is a member of Village Health Sanitization and Nutrition Committee, ASHA. Then she is elected by the Gram Panchayat, supervises the toilet construction and do not conduct the delivery. So this was a PYQ. Then moving on to the functions of the multipurpose worker, female and male, they have given various other functions, and a female will be doing MCH care, conduct the delivery at the subcenter which are low risk and which are multigravida. Then TD vaccines, IFA tablets, and she can do tests like the hemoglobin, blood sugar, urine albumin ratio, and contraceptive advice. Then for the male, treatment of the common diseases like the diarrhea, then pneumonia and vomiting if there is present like these conditions. Then immunization, chlorination, active disease surveillance, sputum collection for the TB, which is a PYQ. Then he is a part of the IMNCI and the IDSP. Then Anganwadi worker, functions of this Anganwadi worker: growth monitoring of the child, provides immunization to the child, midday meal scheme, referral services, non-formal school education and the health education. And these Anganwadi workers are considered as the heart of the ICDS center. Then the village health guide, health education, DOS agent, treatment of the common diseases and contraceptive distribution, whereas these are the functions of the TBA. Okay, so in one page, single page, all the things which are asked from these workers, they have been written, so that will be easier for you in the last minutes. Then moving on to the food adulteration. So this is also a repeat topic. And the diseases, these are the diseases caused, this is a toxin and this is the adulterant used. So Latherism, the toxin that causes this is the BOAA, and the adulterant used is the Kesari dal. Then the clinical feature which you can see with this is the spastic paralysis of the lower limb in the adult. So if at all these things are given in the clinical case and there's a history that the patient is consuming kesari dal, then the diagnosis will be this latherism and the toxin will be BOAA. So questions can be asked like this, kuch bhi question पूछ सकते हैं, either they can ask on the toxin or they can ask on the diagnosis. Then epidemic dropsy, the toxin is the sanguine and this is the adulterant that is used. Then the clinical presentation will be leg swelling, diarrhea and the cardiac failure in case of this epidemic dropsy. Then in case of endemic ascites, pyrrolizidine, this is the toxin and the adulterant is this crotalaria seeds. And the clinical presentation will be the ascites and the jaundice, and this is mainly the hepatotoxic and it will be causing the effect to the liver. Then aflatoxicosis, the toxin is the aflatoxin and the adulterant is the aspergillus flavus or the parasiticus. This is also a hepatotoxic, ये भी hepatotoxicity cause करता है. And ergotism, this is not that important. Okay, so these were the things from the food adulteration. You need to by heart this whole table. Then moving on to the random sampling, so classified into the 4 types: simple, stratified, systemic and the cluster. And image based questions are asked mainly on this, so you need to remember these images also. Simple random में क्या होता है कि there is a population, this is a population and you can see that randomly one person is taken from the population, like इस रो से एक बंदे को लिया, इस रो से one person, then the last person, then here one person. तो ऐसे में there will be a population and randomly they will be picking one population for the studies. Then what happens in the stratified random, there's a population, it is classified into the groups and from that group one random is taken. See, as you can see here that this is the population classified into 1, 2, 3 and 4 group, and 4 group से कोई भी एक random person को they are taking it, like यहाँ से इन लोगों ने इसको लिया, यहाँ से इन लोगों, यहाँ से इसको, यहाँ से इसको, ठीक है. तो रैंडमली किसी को भी पिक कर रहे हैं, दैट वन द स्ट्रैटिफाइड रैंडम, मतलब कि दे आर स्ट्रैटिफाइंग द फर्स्ट एंड देन रैंडमली पिकिंग. देन इन केस ऑफ सिस्टमिक रैंडम, इसमें क्या होता है कि देयर विल बी अ सिस्टमिक मेथड विच विल बी फॉलोड, लाइक द फर्स्ट पर्सन ही विल बी द रैंडम, बट द the first person will be random, and after that every 3 or every 4 person will be selected. Like यहाँ पर we are taking the second one as the random. Now 1 2 3, the every third person after this random is being selected for the study, and it will be like 3 भी हो सकता है, 4 भी हो सकता है, 5 6 7 8 कितना भी हो सकता है. Then moving on to the cluster random sampling. So the population is classified into various groups, and from those groups, two groups are different groups are selected. Like population is divided into the few groups, and from that few groups are selected. As you can see here, 1 2 3 4 5 6, 6 groups are divided, and we are choosing 2 groups. Okay, so this one is for the cluster. So देखो सारे इमेजेस सिमिलर लगेंगे, बट डिटेल में आपको देखना पड़ेगा बिकॉज बहुत माइन्यूट चेंजेस प्रेजेंट है इन इमेजेस में. Then moving on to the school health guidelines. So these are the things which you must remember, and this is also a repeat topic. So one class less than 40 students should be present. Then minus type of desk. So this is a famous question, minus type of desk for the school health. Then door plus window area should be more than 25% of the floor area. One urinal for per 60 and one latrine per 100 students. Natural light, and the natural light should be coming from the left side, and it should be more than 100 square feet. Then other things which you must know is that in 2018 the school health program merged with the Ayushman Bharat program, and this was launched by the board committee and improved by the Renuka Roy committee. School health checkup happens once per 6 months, and school health program comes under the PHC, and the head of this is the medical officer. Okay, so these are the things which can be asked in the school health guidelines. That they can give 4-5 statements, and they'll ask which of the following is true or which of the following is false. Then moving on to the TB resistance. So this is also a repeat topic, and TB में बहुत कुछ है यार, बहुत कुछ. मतलब उसकी डायग्नोस्टिक कैसे डायग्नोसिस करेंगे, फिर स्क्रीनिंग टेस्ट अलग है उसके लिए, तो बहुत सारा है. तो आई थॉट दिस वन इज़ अ रिपीट टॉपिक, तो लेट्स डिस्कस दिस वन फर्स्ट. एंड द टीबी रेजिस्टेंट क्लासिफाइड इनटू द मोनो poly, multi-drug, rifampicin, and the extensively drug, and this is a PYQ asked multiple time. And the MR will be the mono-resistant, means resistance to any one first line drug, that is the HRZES. Just remember HRZES में से कोई भी एक ड्रग रेजिस्टेंट होगा तो इट विल बी द मोनो रेजिस्टेंस. बिकॉज बड़ा सा सेंटेंस याद करने में बहुत डिफिकल्टी होगी, इसीलिए जस्ट रिमेंबर दिस थिंग, HRZES, वन ड्रग रेजिस्टेंट, मोनो रेजिस्टेंट. Then polyresistance में what happens is more than one first line drug except H and R. So H and R के लिए resistance नहीं develop होगा, तो H and R को अगर हम exception निकाल दिया तो it will be ZES. ZES में if the bacteria is developing resistance for the ZES, then it will be the polyresistance. मतलब 2 ड्रग्स इन्वॉल्व होंगी, 2 ड्रग्स के लिए अगर रेजिस्टेंट शो करेगा दैन इट विल बी द पॉलीरेजिस्टेंस. मल्टी ड्रग में इट विल बी H and R both at same time, मतलब कि H and R both are resistant, then it will be called as the multi drug. देखो इतना सब कुछ याद रखने से अच्छा है जस्ट रिमेंबर दिस ना, H and R रेजिस्टेंट, मल्टी ड्रग रेजिस्टेंट, मतलब ठीक है. देन मोनो रेजिस्टेंट, HRZES रेजिस्टेंट, मोनो रेजिस्टेंट, ZES मोर देन 2, पॉली रेजिस्टेंट. देन रिफाम्पिसिन रेजिस्टेंट, नाम में ही हमको पता लग रहा है कि द नेम इटसेल्फ सेज दैट it is resistance to the rifampicin with or without other drugs, and it excludes H. मतलब the patient is not resistant, the bacteria is not resistant to this one H, and other than that it can be resistant to other drugs or no, but it is resistant to the R. Then XDR, extensively में क्या होगा, this is the definition and you need to remember this one. So it will be multi drug resistant, that means this one, and मतलब कि H and R both are resistant. One fluoroquinolone and first one second line injectable drug, which are the kanamycin, amikacin, and the capreomycin. Okay, so these drugs will be resistant. Then moving on to another very important topic, that is epidemiology, case control, and the cohort. So you just cannot miss this topic. And clinical cases type questions are asked, that they will describe a few things like smoking history and lung cancer करके दे देंगे, या फिर pregnancy and pregnancy से related कुछ भी ऐसे describe कर देंगे. तो you need to remember, read the case you need to read the case very carefully and think कि क्या पूछा जा रहा है question में. If it is case control, then it will be a backward study. It is called as a retrospective study, means we will be coming backward. That means outcome to the exposure. तो disease हो गया है ना, we will be going backward to find out the risk factor or the exposure. That will be the rate control. And cohort में we will be calculating the incidence. So this was a PYQ asked that incidence is calculated in which study. So it is the cohort. It is a forward study, also called as a prospective. Then exposure to the outcome, risk factor to the diseases is calculated in this cohort, and three things are calculated: relative risk, attributable risk, and per attributable risk are calculated in this cohort. Okay, so clinical case may, if at all you see this something described like the incidence or relative risk, then exposure, then go with the cohort study. And if the study is going backwards, like you go to a hospital and you look at the number of patients with the lung cancer and go backwards to see the smoking history, then it will be a case control. But in case of cohort, what will be happen that you will be taking the history of the smoking person, जो स्मोक कर रहा है उनकी आप हिस्ट्री लोगे, एंड यू विल बी फॉलोइंग अप देम टिल द फ्यूचर. मतलब फ्यूचर में यू विल बी फॉलोइंग अप देम, यू विल बी लुकिंग कि वेदर उनको लंग कैंसर होगा या नहीं होगा, अगर होगा भी तो कितने पॉपुलेशन को हुआ है, लाइक दैट. एंड ऑल्सो another important thing which you can differentiate is in case and control there will be two groups. So comparison होगा two groups के बीच में. One will be the cases and one will be the controls by which it is कंपैरिजन हो रहा है, जिससे कंपैरिजन हो रहा है. बट व्हाट हैपेंस इन कोहर्ट इज एक ही ग्रुप रहेगा और उसी की जो फीचर्स है पास्ट में और फ्यूचर में उन्हीं को कंपैरिजन होता रहेगा. ओके, सो दिस वर अबाउट द कोहर्ट एंड द केस कंट्रोल. So that was a quite lengthy session and from the PSM, and we have discussed a lot of important topics here. So I think this video will be useful to you all, and along with this, if you watch the other videos of the PSM, then I assure you that 15 to 20 marks easily you can get from these things. If we are lucky enough, if the questions are like repeated and if the pattern will be easy, then easily we will be able to solve most of the questions from the PSM. So thank you so much guys for watching this video. Like the video, share it with your friends, and if you find this video useful, subscribe to GrowMed. I am Dr. Padmini, your mentor for the FMG, and lastly, all the best for the FMG. Hope you all will excel this exam. Thank you so much guys. Bye bye.